Hello there. Welcome once again to the program, Your Doctor and COVID. I'm Dr. Mahendra Carpen. I'm the head of medical services and cardiology at the Georgetown Public Hospital Corporation. We continue to speak about the COVID-19 pandemic. We continue to take questions. We continue to answer all that you send in, whether you're viewing, whether you're listening. Remember, we're encouraging you to continue doing the same. And if you have any questions or comments, feel free to send a WhatsApp message to 620-6275, or you may send an email to docandcovid@gmail.com. I am starting out today, as usual, wearing my mask that covers both my nose and the mouth. And for the rest of this conversation, I will take it off so that you can hear me a little better. So the question was sent in by a viewer or listener just like yourself, and it relates, again, the hot topic for 2021 is around the vaccine that is designed to help us fight the COVID-19 pandemic. So here is the question that was sent in. Can a person or persons with sulfur allergies take the COVID-19 vaccine? Can persons with sulfur allergies take the COVID-19 vaccine? So there's an important thing to recognize, that there are a lot of overlapping symptoms between COVID-19 infection and an allergy, for example. And so they both can cause coughing and runny nose. And however, specific to the coronavirus, we have more fever, shortness of breath, body ache, fatigue, sore throat, gastrointestinal upset like vomiting, nausea, diarrhea, etc., loss of taste, loss of smell, and sometimes you have what you call conjunctivitis, which is redness and inflammation in the eyes. For allergies, the specific symptoms for allergies are things like congestion, sneezing, wheezing, itchy nose and throat, itchy eyes and ears, sinus congestion, and of course that thing that we call post-nasal drip, which is that tickling at the back of your throat because your sinuses are draining, and a lot of people will have to cough to clear their throat. So those are the specifics, and the overlap between the two include things like coughing and runny nose. Allergic reactions can occur due to a number of things, and these can be categorized like due to skin contact, due to injection, due to ingestion, and inhalation. Skin contact are things like poison plants or animal scratches, pollen and latex. These are some of the things, the material that make gloves that some doctors and others may have to use. Injection, for example, if you get stung by a bee, ingestion are things that you take in. You take by mouth usually, and that can be medications, nuts, and some people, like myself, have an allergy to shellfish. That's your shrimp, crab, lobster, etc. And of course, breathing in, especially during springtime or when we have grass cutting and so in the countryside, we are affected by pollen, dust, mold, mildew, and animal dander. These are all things that can cause allergies, and the symptoms of having allergies are quite well known. These range from coughing, itchy nose, a runny nose, blisters, edema or swelling. This can affect the face, the hands, etc. Sneezing, redness around the eyes, the lips, the mouth, and itching, especially if you have what we call contact dermatitis. You know about certain plants that if you touch them, it causes severe rashes and itching on the skin. That is one of the other ways in which people have symptoms of allergies. Specifically to the question that was asked relating to sulfur, we need to understand what are things high in sulfur. Sulfur is something that we ingest a lot as part of our dietary intake. And foods that contain a lot of sulfur include meat and fish, eggs, cheese, the tea that we drink, cocoa, and certain dried fruits like apricots. These are things that are particularly high in sulfur. As we look at allergic reactions, there is a specific type of reaction called anaphylaxis. And this is a severe allergic reaction, oftentimes requiring patients to present to the emergency room, and they need things like adrenaline injection, etc., to recover. It is a very scary type of allergic reaction and can be associated with very bad outcomes. So the common things that we see in patients who have anaphylactic reactions include headaches and anxiety, stridor and shortness of breath. That's when they're breathing, you're hearing a lot of extra sounds when they breathe in. They may have abdominal pain. There's an increase in the heart rate, or what we call tachycardia, and sometimes the blood pressure can actually drop to a dangerous level where there's not enough blood flow to the brain, patient can faint and fall down, etc. And then of course you can have things like itchiness and swelling. One of the most severe type of reaction can involve swelling of the tongue so bad that patients are unable to swallow, and also swelling of the soft tissue in the upper respiratory tract, so air cannot get down into the lungs. It's a very scary scenario and oftentimes need immediate attention by way of trained medical personnel or hospital emergency room, where injections and other interventions are performed to help save the lives of patients who have anaphylaxis. There's a specific thing called anaphylactic shock, which is also part of and parcel of this entity. It is really a serious, life-threatening allergic reaction that is rapid in action and may cause death. So rapid onset and can cause death. Commonest causes include things like insect bites or stings, some foods, and some medications. And remember again, when this happens, it is not time to stay home and watch and see how you will recover. This is a serious thing that needs to be addressed immediately in a medical setting by trained medical professionals. Specific causes for anaphylaxis, these range from foods like peanuts, some seafoods, and milk. Some medications are known to be associated with anaphylaxis reaction. These include penicillin and some what we call non-steroidal anti-inflammatory drugs, or NSAIDs. Examples of these include the common ibuprofen or Motrin, Voltaren. All of these are NSAIDs or non-steroidal anti-inflammatory drugs. Insect stings can cause these as well, including being stung by bees, wasps of marabunta, and ants as well. The less common causes for anaphylaxis are things like latex, and unfortunately a lot of medical equipment and household protective equipment contains latex, and that includes things like the gloves that you wear. Some of the gloves that people wear to clean houses, etc., and clean bathrooms and toilets are made from latex material. some of the gloves that doctors and nurses and healthcare professionals wear to protect themselves and patients from infection are also made from latex. And some other material like condoms are also made from latex. So it's important to recognize these as well as common potential triggers of an anaphylactic reaction. Some patients may have severe allergic reaction that are triggered by exercise, and there's such a thing known as exercise-induced asthma. Now, asthma is an inflammatory condition that affects the airways, and people are unable to breathe properly and need lots of medical attention to be able to control asthma. Now, as it relates to the COVID-19 vaccine, it's a very, very important consideration if people have allergies. Now, the symptoms of allergies in the context of the COVID-19 vaccine include things like rapid or fast heart rate, a skin rash, feeling of flushness, especially in the face, as well as the development of shortness of breath. Now let's look at the overall risk for anaphylaxis with vaccine. This is even before the era of COVID vaccine. The overall risk for anaphylaxis, which is the worst type of allergic reaction, is 1.3 patients per 1 million doses. 1.3 per 1 million. So far, across the world, with several millions of Pfizer vaccine being administered, there are 4 described cases of anaphylaxis. So it is not an increase in the prevalence of anaphylactic reactions that is seen. It is quite in keeping with what we know about normal vaccine reactions. It is very rare, and thankfully it is just the same in terms of its prevalence, the number of persons developing this adverse reaction. The same for this vaccine, these newer vaccines, versus all of the well-established, well-studied vaccines. The treatment for anaphylaxis or the anaphylactic reaction, if it does occur, include things like Benadryl, epinephrine or adrenaline, steroids, and medical observation. That is observation under medical supervision. If we look at the specific criteria that was developed by Pfizer to screen patients for appropriate use of the vaccine, there are some patients who should not receive the vaccines. And these are persons who are known to have had an anaphylactic reaction in the past, particularly if that reaction was to some component that the vaccine is made up of. So if you've had a history of anaphylactic reaction to a component of the vaccine, you should not receive the vaccine. However, most other persons, if they have even mild or moderate allergies, that includes things like, the skin rashes, the development of a little bit of increased heart rate, those milder forms of allergic reactions do not prevent patients from receiving the Pfizer COVID vaccine. So the conclusion of this particular question, people with anaphylactic reaction or a history of anaphylaxis should not take the vaccine, especially if they are known to have had a reaction to a component that is included in the vaccine. We need 2 doses of the vaccine to develop adequate immunity. Day 1 is the first dose of the vaccine. By day 12, that's when we start developing immunity after the vaccine would have been given. A second dose or a booster dose is given at day 21, and we anticipate that full immunity would have developed by day 28. So if you were to look at between day 1 and 12, from the time the vaccine was given to the time where you start to build immunity, it is still possible that persons can become exposed and become infected during that time. But we have to continue trying to find the right answers. So I hope this answers the question about sulfur allergy and the use of the COVID-19 vaccines. Please feel free to continue sending your questions and comments to WhatsApp at 620-6275 or send an email to docandcovid@gmail.com. Thank you once again for joining me, and do have a wonderful weekend.